I'm Christine Gleason, and I am Emerita Professor of Pediatrics at the University of Washington in the Division of Neonatology. I am one of the co-editors of Avery's Diseases of the Newborn.
I'm Taylor Sawyer. I'm a neonatologist at the University of Washington and Seattle Children's Hospital here in Seattle. I am lucky to be the co-editor of the 11th edition of Avery's Diseases of the Newborn.
So this is the 11th edition of Avery's Diseases of the Newborn, and it's the 4th edition that I've been privileged to co-edit. First edition of Avery's was actually called Schaffer at the time, who was a pediatrician in Baltimore, Maryland, and it was published in 1960. And Dr. Schaffer actually is the one who coined the term neonatology. One of the most exciting things about this edition is that it's still one volume. I think it's actually even more concise than the previous edition. It's about 200 pages less, actually, than the last edition. And that's in large part to some of the contributions that Taylor Sawyer made as we were going through the table of contents and realizing that the focus of Avery's Diseases of the Newborn really needed to be diseases, disorders.
I'd like to highlight the idea that you can also access the content of the textbook online. When you get the textbook, there's a code that you can redeem through Elsevier, and you can get full access to the ebook. That's one great resource. There's all the images are reproduced there, and it includes some amazing videos. So those are great to access if you're interested in that. And it just makes it more user-friendly for folks who don't want to or can't get access to their hard copy all the time and want to be able to access it on the go on their computer or their phone. I'd like to highlight some of the expanded and new content for the 11th edition. One of the obviously hot off the press issues was the COVID-19 pandemic. So the viral chapter in the 11th edition includes updated materials on all the common viruses that affect newborns, including Zika, but an entirely new section on SARS-CoV-2 virus. So I think that'll be very helpful to folks in practice. In addition to the viral chapter, there's a brand new chapter on neonatal gastroesophageal reflux and intestinal motility, because I know that's a big clinical challenge for folks at the bedside. And then as the science has progressed, there's been more and more material and publications on necrotizing enterocolitis and short bowel syndrome. And we really expanded the chapter on that topic with this edition to include the newest science in that area.
All the new information on genomics that has come out, prenatal drug exposure, and all the different ways that we're learning to manage those pregnancies and babies better. Palliative care, pain management. These are what I think we would all consider hot topics in neonatology, and to have our contributors be able to bring us up to date and then think about what's needed, what's new, what's pending is really, I think, a highlight of the 11th edition.
When I think about who the readers of Avery's should be, and obviously are, I think really, the physicians come to mind, those pediatricians and neonatal specialists who focus on care in the newborn in the NICU. But I also think about the advanced practice providers, including nurse practitioners and physician assistants who are really a vital part of the care for newborns in many NICUs around the world. I think the content is also applicable to allied healthcare providers, nurses, respiratory therapists, pharmacists, and dietitians who work with us in the NICU. There are specific chapters and sections that are relevant, to all of those different areas of practice. And so we try to make it really broadly applicable to the entire neonatal workforce.